All right, today we are mapping out a patient's entire surgical journey. We're going to look at the critical role of the perioperative nurse, and not just as someone who's checking off boxes. Think of them more like the architect, the person who designs a patient's safe passage from the very beginning to the very end. So let's jump right in. Okay, so before we go any further, you gotta get this. Everything, and I mean every single thing we're about to talk about, it all comes down to these two core priorities: infection and safety. Seriously, these are like the two North Stars that guide every single decision a nurse makes. So, that really brings us to the big question, right? Surgery is so much more than just the time spent in the operating room. A surgeon might be in there for a couple of hours, but the nurse, they manage the entire journey. We're talking days, sometimes even weeks. So, how do they guide that patient safely through the whole thing? Let's map it out, and we'll start right at the beginning. All right, section 1, pre-op. This is all about preparing for success. And listen, what happens here is absolutely crucial. I can't stress that enough. The work that's done before surgery is what's going to prevent major problems after surgery. You can think of it like this: a successful post-op recovery is built on a rock-solid pre-op foundation. One of the very first things that has to happen is getting informed consent. Now, yeah, the surgeon is the one who explains the procedure, but the nurse's role here? It's so much more than just watching someone sign a piece of paper. The nurse is the patient's final advocate, their last line of defense. They have to make sure the patient truly gets it, the risks, the benefits, everything. And if there's even a little bit of doubt, the nurse's job is to hit the brakes and get that surgeon back in the room. That, right there, is what patient advocacy is all about. And that leads us to patient teaching. This isn't just a to-do list. It's about empowering the patient, giving them the tools they're going to need to take an active part in their own recovery. We're not just checking boxes here. It's all about making sure they understand the why behind everything we're asking them to do. And that starts with some really simple but incredibly important exercises. So you teach the patient these simple leg exercises. And when you look at them, calf pumping, foot circles, you might be thinking, really? What good is that going to do? They seem so minor, right? Well, it turns out these tiny little movements are designed to prevent a very big, very dangerous complication down the road. And that big problem is called thrombophlebitis. See, after surgery, a patient isn't moving around much, and when that happens, blood can just sit or pool in the deep veins of the legs. That lack of movement, we call it stasis, creates the absolute perfect storm for a dangerous blood clot to form. And this is where it all clicks. This is the why. That simple action of pumping your feet. That's what keeps the blood from just sitting there. It prevents the stasis. And if you prevent the stasis, you prevent the clot. It's a direct line. A super simple exercise you taught them before surgery prevents a potentially deadly complication after surgery. That's powerful stuff. Okay, let's move on. The patient is out of the OR and we're now in the post-op phase. This is where the nurse has to be on high alert. We're talking maximum vigilance here. The anesthesia is starting to wear off and the patient's body is dealing with a ton of stress from the surgery itself. So the first thing you check, no exceptions, are the ABCs: airway, breathing, circulation. Is their airway clear? Are they breathing okay? Is their circulation stable? Everything, and I mean everything else, can wait. This is the bedrock of patient safety in those first few critical moments after surgery. All right, for anyone studying for an exam, you're going to want to screenshot this slide. These are your absolute must-know numbers. Respiratory rate above 10, O2 sat over 95%. But look, pay really close attention to that last one, urine output. We need to see more than 30 milliliters per hour. Why is that number so important? Because it's a fantastic, super quick way to see how their circulation is doing and if their kidneys are getting enough blood. If it drops below 30, you've got to report it, simple as that. Okay, so now let's talk about complications. We're going to map out the pathways of how things can go wrong. And the goal here isn't just to memorize a list of bad things that can happen. It's about understanding the chain of events, seeing how one thing leads to another, so you know exactly where you can step in and break that chain. So let's take a really common example. How does a patient actually get pneumonia after surgery? I mean, it's a huge post-op risk, but it doesn't just, pop up out of thin air. It's actually the very end of a pretty predictable chain reaction. Let's follow the breadcrumbs. It all starts with the patient not moving and being in pain. Because it hurts to take a deep breath, they just don't. They take these little shallow breaths. That lets all this mucus just pool in their lungs, and it can form thick plugs. Well, those plugs then block off the tiny little air sacs, the alveoli, and they collapse. That collapse is called atelectasis. And now you've got this perfect little breeding ground, warm, dark, and wet, where bacteria can just go to town. And that is how you get pneumonia. And this image here shows you exactly what we're talking about with atelectasis. On the left, you see a nice open airway. But look at the right. See that mucus plug just jamming up the works? It completely blocks off that little tube. All the air that was trapped behind it gets absorbed, and poof, the little air sacs just collapse on themselves, kind of like a deflated balloon. This is literally what happens because of those shallow breaths. So the big question is, how do we stop this from happening? Well, we break the chain. Remember all that stuff we taught the patient before surgery? Deep breathing, using that incentive spirometer, that stuff literally pops those collapsed alveoli back open, and getting them up and walking around. Early ambulation keeps the mucus from pooling to begin with, you see? Every single nursing action is like a precision strike aimed at a specific link in that dangerous chain. All right, we're heading into the home stretch. Our last section is all about wound care and getting the patient ready to go home. This is the final leg of the journey, and trust me, it is just as important as everything that came before it. Okay, 2 words you absolutely have to know the difference between: dehiscence and evisceration. Dehiscence is when the wound edges separate. That's bad. But evisceration, that's a whole other level. That is a full-blown surgical emergency. It's when internal organs are literally poking out of the incision. Knowing the difference is beyond critical. And if a patient ever says to you, "I feel like something just gave way," or maybe they felt a pop when they coughed, listen, every alarm bell in your head should be going off. That is the classic textbook thing a patient says right when an evisceration happens. It's your signal to act, and to act fast. And this is exactly what you do. First, do not leave the patient. Stay right there and call for help. Get them into a low Fowler's position and bend their knees. That's going to take some pressure off the abdomen. You need to cover the wound and any organs with a sterile dressing soaked in normal saline to keep everything from drying out. And then you're watching their vital signs like a hawk for any signs of shock and getting them ready to go right back to the OR. These steps, done quickly, can absolutely save their life. So the last big job for the perioperative nurse is discharge teaching. And again, this is not just about giving someone a pamphlet of rules. This is the final handoff. You're giving the patient all the knowledge they need to be their own safety expert at home. They've got to know how to take care of that incision, what to look for with infections, and really important stuff like not lifting anything heavier than, say, a gallon of milk. This final piece of teaching is what makes sure this whole long journey has a safe and successful ending. And that really brings us full circle. Think about it. The surgeon is the technical specialist for a few hours in the OR, but the perioperative nurse, they are the guide, the teacher, the protector, the safety architect for the entire experience. From the second that patient decides to have surgery, all the way until they're safe and sound back at home. That's the incredible scope and the huge responsibility of being a perioperative nurse.